Hello, my name is Kelly Alter, and this presentation is about my doctoral capstone experience, or DCE. The title of my presentation is Outcome Measures at a Private Outpatient Pediatric Occupational Therapy Clinic. To begin, my capstone falls under the ACO concentration area of administration and leadership. My project took place at a private outpatient occupational therapy clinic called Sensory Systems Clinic West, or SSCW. They service primarily pediatric clients, however, they also work with some adult clients. Their motto is play to learn and learn to play, as they provide more play-based therapy. My site mentor was Peggy McCory. She is a licensed OT and is the owner of Sensory Systems Clinic West. She has owned the business for over 11 years and has been able to steadily grow her clients and therapists. For my abstract, I just wanted to touch on the three main aims of my doctoral capstone experience. This was to improve methods of collecting outcome measurements, improve the physical environment of the clinic, and improve a variety of business management areas and systems throughout the clinic. In terms of my literature review, I focus primarily on outcome measurements, specifically what they are, types of outcome measurements, why they're important, barriers to routinely measuring outcomes, as well as what gaps there were in the literature. For what outcome measurements are, they can either be standardized or non-standardized and can measure a change in patients' occupational performance, participation, and overall functioning over time. Throughout the literature, I found a variety of reasons why outcome measurements are important. Specifically, they're vital for value-based payments as they're important for receiving reimbursement. Outcome measurements are a great way to demonstrate the change that clients have made in their performance and overall the quality of care instead of just the quantity. Also, the types of outcome measurements, there's a variety of them. However, for my experience, I focus primarily on patient or caregiver satisfaction of services, as well as progress towards overall goals. And I did this through a variety of ways, but one way was improving the questionnaires that they already have or creating new ones, and then introducing the staff to a standardized goal attainment scale, or GAS, which is used to quantify progress toward individual client goals through collaboration and construction of personalized goal scales. However, there are barriers to routinely measuring outcomes. Within the literature, it was noted that knowledge, education, and perceived value in outcome measurements were among these barriers. Additionally, support and priority for integrating outcomes were also noted as barriers, and throughout my capstone experience, I came face to face with all of these barriers at different levels. But overall, I strived to provide opportunities for Sensory Systems Clinic West to implement routinely measuring outcomes. Finally, one area in the literature that seemed to be lacking is the implications for a clinic's environment on overall outcomes. Research would need to be done to investigate if a clinic's environment impacts the outcomes for the client, while also looking at its impact on therapists' work performance. Although this gap did exist in the literature, after seeing the clinic and talking with staff, it was clear that the way the space was currently organized and the amount of visual distraction this was a weakness for the clinic, and I could help improve that and overall improve the interactions and behaviors with the therapists and their environment. This leads me to the next thing that we completed for our capstone, which is the needs assessment. This was done by completing a strengths, weaknesses, opportunities, and threats, or SWOT analysis. And after interviewing the majority of the staff, I found that although the clinic had a number of strengths, such as dedicated staff and flexible work hours, there were also some weaknesses, including overwhelming treatment spaces, lack of objective data, and the need for improved systems related to administration. Therefore, my capstone attempted to address these weaknesses through the following objectives. Having me review and update clinic policy and procedure manuals with the most up-to-date practice information, introducing goal attainment scaling, or GAS, with the staff and assess the practicality of using this outcome measure at the specific site, implementing organizational strategies throughout the clinic for improved efficiency, and implementing systems for improved gathering of outcome measurements to demonstrate Sensory System Clinic West's unique value. As far as the implications of my capstone, there were three main areas of impact, specifically physical environment of the clinic, as well as multiple business-related systems, and overall outcome measurements and how the clinic went about doing this. In conclusion, my capstone allowed me to provide a more organized and functional clinic for the therapists. I was able to provide this by organizing and paring down items, as well as initiating and overseeing cabinet installations and just general organization to better aid the therapist so that way they knew where everything was. I was also able to increase opportunities for gathering outcomes. I did this by providing them documents and questionnaires to provide patients at progress time, as well as at discharge, and through the use of the goal attainment scaling or the GAS. I was also able to gain growth in administration and leadership skills overall as I oversaw and learned more about what Peggy does in her day-to-day operations. Here are my references. And my appendices, there's a number of them in my paper. However, I just wanted to highlight a couple here during the presentation. Specifically, this first one is a before and after picture of the kitchen area. As you can see on the left-hand side, the kitchen is very cluttered. There's a lot of stuff on the counters. And then the right-hand side, less cluttered, some labels. This area is a space where standardized assessments take place, so it can be overwhelming sometimes for clients. And this is one of those cabinets. The staff has told me that it's more manageable and the supplies actually get used more this way. And here's the other side of that area. Again, overwhelming, stuff stacked on top of each other. But on the right-hand side, more manageable. This is one of those forms that I produced for the clinic so that they can more routinely measure those outcomes. And here is the form for current clients. And then these are the table of contents for the binders that I updated, including the policies and procedures manual and the orientation binder. And finally, this is the telehealth policies and procedures manual that I created for them. Thank you so much for listening to my presentation.